When it is safe for you to approach a victim, you should attempt to determine the victim's responsiveness by tapping and shouting. What are the effects of shock? 1. Reduced oxygen to body tissues and organs. 2. Low body temperature due to restricted blood flow. 3. Reduced blood flow to body tissues and organs. The O and the dots of victim secondary assessment stands for open injuries. At the scene of a traffic collision, you find an unconscious victim inside one of the vehicles with evidence of a neck injury. How do you open the airway? Use the jaw thrust maneuver. When giving back blows or chest thrusts to an infant, what is the correct position for the infant's head and chest? The head should be lower than the chest. Place the following links in the chain of survival in the correct order by dragging each link on the left to the chain list, on the right. 1. Immediate recognition of cardiac arrest and activation of the emergency response system. 2. Early cardiopulmonary resuscitation, CPR, with an emphasis on chest compressions. 3. Rapid defibrillation. 4. Effective advanced life support. 5. Integrated post-cardiac arrest care. A mild airway obstruction is a condition in which 1. The victim indicates an airway problem but is able to speak or cough. 2. An adult is conscious and violently coughing and red in the face from the ordeal. Which of the following images shows a victim in the correct recovery position? Photo of guy laying on side with knees tucked toward chest. You should check for indications of life-threatening conditions and place the victim in the recovery position if the victim has. What type of problem would an officer expect to find while performing a secondary assessment? Dislocated shoulder. What are the first aid measures for an impaled object? 1. Stabilize the object to avoid additional damage during treatment. 2. Apply pressure on both sides of the object to control bleeding. 3. Expose the wound. For an avulsion, when the body part is not completely separated, you should place the separated tissue back in place before applying dressings or pressure bandages. True. An officer who has conducted a secondary assessment of vital signs of a conscious victim should be prepared to advise EMS of their assessment results, including respiratory rate and pulse. True. What is the correct hand position for performing abdominal thrusts on a conscious adult? On the middle of the abdomen, just above the navel and well below the lower tip of the breastbone. Place the bleeding control measures for an open wound on an extremity in the correct order. 1. Expose the open wound side. 2. Assess for possible fractures associated with the open wound. 3. Apply direct pressure. 4. Apply pressure bandage. 5. Apply tourniquet. What could compromise a drowning victim's airway? Vomit. What is the correct hand position for clearing a severe airway obstruction on an obese or pregnant adult? On the midline of the sternum, level with the armpits. What is the normal breathing rate for a child, 1 year to puberty? Shock is a life-threatening condition. True. Which of the following statements is true regarding direct pressure? Direct pressure should be applied using a gloved hand or clean dressing until bleeding is controlled. Identify which of the following apply to the use of a hemostatic dressing. 1. After applying the dressing, apply direct pressure. 2. Tightly pack the wound with hemostatic gauze. You find an accident victim who is unconscious, and there is no evidence of a spinal injury. To ensure an open airway, what should you do? Use the head tilt/chin lift maneuver. Confusion, combativeness, and anxiety may be symptoms of shock. True. Select the image that represents the radial pulse location on the wrist. Drag the correct numbers to the correct position for 1 and 2 person child CPR. Compression rate, per minute, 100-120. Rescue breath duration, 1 second. Compression to rescue breath ratio, 1 person CPR, 30:2. Compression to rescue breath ratio, 2 person CPR, 15:2. Compression depth, 2 inches or 1/3 chest depth, after a shock is delivered. The compression to ventilation ratio of 30:2 is the same for both 1 and 2 person CPR on an adult. True. Which of the following statements are true of using a tourniquet for bleeding control? 1. The time the tourniquet was applied should be noted, reported to EMTs. 2. If the victim is covered, leave the area where the tourniquet is located exposed for EMTs to see. If you are required to perform rescue breathing on a victim whose mouth is injured, a pocket mask may be used in the mask-to-nose position. True. Match the airway obstruction conditions to their severity. Mild. 1. An adult is conscious and violently coughing and red in the face from the ordeal. 2. The victim indicates an airway problem but is able to speak or cough. Severe. 1. An adult is conscious but unable to speak, cough, or breathe. 2. A victim is unconscious and unable to breathe after the airway has been opened and a finger sweep performed. In the case of an amputation, which of the following precautions should be taken with the separated body parts? 1. Transport the amputated part with the victim if possible. 2. Keep the amputated part dry. 3. Attempt to locate the amputated part. 4. Keep the amputated part cool and protected. Someone with no history of mental illness may manifest symptoms of a psychological emergency. True. After activating EMS, what should an officer do for an unresponsive victim? Check the victim's airway, breathing, and circulation. The pads are not sticking to the victim's chest. Which of the following may be a likely cause? 1. The victim has a wet chest surface. 2. Excessive hair on the victim's chest. When giving ventilations to an infant, only use as much air as it takes to fill your cheeks. True. At a construction site, an injured worker has a large piece of metal impaled through his right calf. What are the correct first aid steps? Stabilize the piece of metal in place with a bulky dressing. Jewelry does not need to be removed from the patient's chest if the jewelry does not touch the automated external defibrillator. Pads. False. How should a pulse rate normally be calculated? Select the answer that best represents proper steps for applying a hemostatic dressing. Tightly pack hemostatic gauze. Apply direct pressure for 3 to 5 minutes. Apply pressure bandage. Prepare for transport. Once an officer suspects that a victim has an altered mental status, which first aid measures should be considered? 1. Calming and reassuring the victim. 2. Taking proper officer, public safety tactics, should the victim's altered mental status escalate. 3. Changing environments. It is unable to complete analysis. Which of the following may be a likely cause? 1. Radio frequency interference. 2. Excessive movement of the patient. 3. Giving rescue breaths during analysis. 4. Vehicle motion. How does an automated external defibrillator work? It shocks the heart out of a fatal rhythm so that normal rhythm will resume. The compression to ventilation ratio for two-person CPR on a child is 15:2. Drag the correct numbers to the correct position for one-person adult CPR. Compression rate, per minute, 100-120. Compression depth, 2 inches. Compression to rescue breath ratio, 30:2. Rescue breath duration, not 3 seconds. When dealing with a victim of an amputation, an officer should not be concerned about locating or preserving the amputated part. False. A severe airway obstruction is a condition in which 1. An adult is conscious but unable to speak, cough, or breathe. 2. A victim is unconscious and unable to breathe after the airway finger sweep performed. Drag the correct numbers to the correct position for one-person infant CPR. Compression rate, per minute, 100-120. Pulse location, brachial. Compression to ventilation ratio, 30:2. Compression depth, 1/3 chest depth. Which of these methods is used to open the airway of a victim with a suspected spinal injury? Jaw thrust maneuver. What is the benefit of placing a victim in the recovery position? It allows drainage from the mouth and prevents the victim's tongue from blocking the airway. The first step in the chain of survival is immediate recognition of cardiac arrest and activation of the emergency response system. An officer finds a male victim who appears to be in shock, but does not seem to have any head, neck, or spinal fractures. What is the proper position for treatment? Not lying on his side with legs bent. When an officer has completed a primary assessment and begins a secondary assessment, what must the officer remember to do? Check the victim's body for injuries in an orderly manner. When providing first aid for a choking victim who is pregnant or obese, chest thrusts should be used instead of abdominal thrusts. True. Which of these best describes cyanosis? Select your choice. Bluish skin, Direct pressure is the most effective method for controlling bleeding, and it should be attempted before resorting to other bleeding control options. True. Which of the following steps would apply to conducting a secondary assessment of a conscious victim? 1. Conduct a head-to-toe assessment. 2. Gather information regarding the victim and the incident, including patient history. 3. Check and document vitals. What sources of information might be found at the scene of an accident? 1. The victim. 2. Family members. 3. Medical alert jewelry. 4. Witnesses. The rapid, systematic process to detect life-threatening conditions is Primary assessment. You are administering abdominal thrusts to a choking unconscious coworker when she loses consciousness. You open her airway and attempt to give a ventilation, but it does not produce a visible chest rise. What are the correct next steps? Administer chest compressions. Check the mouth for any visible obstruction. Attempt ventilation. At the scene of a vehicle accident, an officer finds a female victim who appears to be in shock and suffering from multiple leg fractures. What actions should the officer take? 1. Treat the victim's injuries. 2. Monitor the victim's vital signs. 3. Reassure the victim. How long should you feel for a pulse before starting CPR on a child? Not at least 10 seconds but no more than 30. At least 5 seconds but no more than 10. A victim has a pulse but is not breathing. What first aid measures should be taken? 1. Open the victim's airway with the head tilt/chin tilt or jaw thrust maneuver. 2. Begin rescue breathing. 3. If available, place a pocket mask over the victim's nose and mouth and exhale directly into the mask valve for 1 second. When the automated external defibrillator advises shock indicated, 1. Make sure no one is touching the victim. 2. In a loud, strong voice, call out clear. 3. Press the shock button. Where do you check an infant's pulse before starting CPR? The brachial artery. Which of the following statements are true of a tourniquet being used for bleeding control? 1. A tourniquet should only be used for life-threatening conditions where direct pressure has failed. 2. The time of tourniquet placement and its location on the victim should be noted and reported to the EMTs. 3. A tourniquet can be made from any material wide enough so as to not cut into the victim's skin. When treating someone for shock, you should 1. Control all external bleeding and treat other injuries. 2. Maintain the victim's body temperature. 3. Not give them anything to drink as it may lead to vomiting. An automated external defibrillator works by stopping the heart so that it can resume a normal rhythm. True. How long should you feel for a pulse before starting CPR on an adult? Not at least 10 seconds but no more than 30. What is the compression rate for one person CPR on a child? 100 per minute. An officer sees a woman suddenly start to choke while eating dinner. She is conscious and making a high-pitched noise. What should the officer do? Ask her if she is choking and administer abdominal thrusts. What is the correct hand placement for CPR on an adult? Photo of hands even with the nipple line. What is the purpose of the secondary assessment? To discover any other injuries. Which of these factors must be kept in mind when performing a secondary assessment? 1. Not pressing hard on any known injury. 2. Looking for cuts, bruises, and other signs of injury. 3. Checking the victim's body in an orderly way. What vital signs should you check during a secondary assessment? 1. Pulse rate and character. 2. Respiration rate and character. 3. Skin temperature and color. 4. Temperature. An infant has an obstructed airway and is conscious. An officer gives 5 back blows but the airway remains obstructed. What should he do next? Not do a finger sweep of the mouth. The T in the dots of victim secondary assessment stands for tenderness. What is the normal breathing rate for an adult, puberty and older? 12 to 20 breaths minute. The compression to ventilation ratio for one person CPR on an infant is 30:2. What is the compression to ventilation ratio for 2-person CPR on an adult? 30:2. The compression to ventilation ratio for 2-person CPR on an infant is 15:2. Drag the assessment on the left to the first responder action on the right. Begin rescue breathing. Victim not breathing with pulse. Begin CPR. Victim not breathing with no pulse. Complete secondary assessment. Victim is breathing. Which of these are characteristics of respiration? 1. Shallow/deep. 2. Easy. Labored. Which of the following situations indicate a possible psychological emergency? 1. A person is walking through traffic, disoriented, perspiring excessively, and crying. 2. A witness at a murder scene is unresponsive to your commands. When performing CPR on a child, the compression depth is 2 inches, or approximately 1/3 chest depth.